All right, welcome everyone. First of all, congratulations on making it to the finals for the grand speech battle. As you all know, the motion for today is this House regrets the reopening of our economy. Each speaker is going to be given 5 minutes uninterrupted and 1 minute of cross-examination, and we'll do 3 minutes for your reply speeches. Are the affirmative ready?
Yes.
Is the negative ready?
Yes.
All right, let's begin.
Three months ago, the reopening of the economy was going to determine not only the fate of the economy, but also the health of the citizens. In this debate, we're going to assess the counterproductivity of an over-ambitious and strategic policy. Regardless of the good that it has brought, we'll show you that the bad has outweighed it and given us cause for regret. In my speech today, I'll be defining the key terms in the motion and giving the arguments in favor of the motion today to prove to you why we regret the reopening of our economy. Now, to go into the definitions of the motion today. Regret is the belief that would rather something hadn't happened, and opening up the economy is the resumption of everyday economic activities, including trade, social services, etc., etc. Altogether, the motion is asking us to prove that the reopening of the economy has caused more harm than good, causing us to regret it opening in the first place. Now, a few clarifications. This debate is not about an alternative way we should have gone about things, but assessing how the way we did go about things gave a negative impact, and that the opening of the economy 3 months ago imposed very many negative impacts that outweigh the good it has created. Now, on to our arguments. Today, we're going to be arguing, one, that we had a lagging infrastructure that was not going to tackle, we had a lagging infrastructure that was not going to handle the reopening of an economy. I'll prove this to you in one way. One, the idea of a cashless economy. Now, part of opening up an economy was ensuring that the payments were e-payments so that people do not continue to interact, get in close proximity to one another, and exchange money. Now, in a desperate attempt to impose this policy, MTN monetized off of this. And what we mean is that it increased the pricing of transactions. Now, what they expected was that people would comply and money they would be living in a cashless economy. But we know that's not what happened because, again, the prices were increased, so people did not comply. What we saw is that I feel like a few people in this room can testify to this. If you're getting a bike or a motorbike and you're trying to pay with a Momo transaction, the bike guy will more likely say, if you give me money from Momo, they're going to mobile money, they're going to cut down my money, giving me a loss more than a profit. So I'd rather you give me money through cash. So again, they expected a cashless economy to actually work, overestimating the willingness of people to comply when they know they're going to make losses. Now, this unstrategic policy ended up, again, this problem they tried to solve continued to happen because people continued to exchange money because they didn't want to make losses. Now, my second speaker will elaborate more on our second argument, which is going to be we had an insufficient medical equipment team. Now, side opposition will probably come here and try to argue that reopening the economy was to help the poor people and improve their standards of living, but let me prove to you exactly how it actually doesn't do that. Now, the first thing is, I'm going to show you this to you in 4 ways. One, poor people are actually more susceptible to getting in contact with the virus with an open economy. You know why? Because they no longer have jobs that, keep them like buildings or anything. Again, another way, one argument so that I can get into this more better is when workplaces were letting go of people because, again, they couldn't handle paying for all these people. What they did, though, who do you think they're going to release first? It's people without degrees, people doing simpler jobs, so they could be able to provide for those high-working people. So the poor people are going to end up what? Being in an economy where they don't have jobs, and what they're going to do is the next best thing, hustle. Through hustling, they're going to be on the streets, in marketplaces, getting in contact with the virus, and again, with already existing, they're more susceptible to, health systems that are not going to help them in terms of, to get tested for the virus, it's $50. Do you think a poor person is going to afford that? They're not going to be able to afford that. But what they want to afford is food to eat. They'll go in marketplaces, regardless of the virus, regardless of anything, do any activity to get this money. So poor people are susceptible to getting in contact with the virus, to spreading it, and not even getting treatment to begin with. Now, the second argument is when you look at the parts of the economy that opened, it actually favor the poor people. Now, the education sector is one of the main ways poor people can break intergenerational poverty by sending their children to school. Now, if you have shut down the one place they could have used to break the intergenerational poverty, you're going to leave them stranded in an economy where their kids are not going to school. The one person they hoped and relied on in their families to go to school is going to be out there trying to put food on their table. What they're going to do is steal, go into other criminal activities, and end up actually increasing their crime rates in the country in a desperate attempt to help them. You're not actually helping them. Now, they lost their jobs. They don't have money. They're more susceptible to getting in contact with the virus because at this point it's a matter of life and death. What do you think they're going to do? They're going to increase crime rates, they're going to get sick, and a policy that in the beginning tried to help them actually makes their lives worse, which is something we're going to continue to argue as side proposition. We're not giving an alternative, but we're trying to show you that this policy was over-ambitious and actually did not meet the needs it tried to give. They tried to help poor people. We have shown you how they actually didn't help them because life is going to be worse for them. 2, they tried to believe that people are going to comply with the cashless economy. It didn't work. 3, the medical, my second speaker will elaborate more, the medical equipment we had was not even actually in favor. So what ended up happening is an increase in the number of people who have the virus. Poor people actually go into more illegitimate businesses, such as making fake hand sanitizers because they can't afford hand sanitizers to begin with. And we see that this sketchy of ambitious policy actually was too overambitious and did not actually meet the needs of these people. At the end of the day, giving us more harms than goods, the harms that I've stated above, and that is reason and cause enough to regret. Proud to propose.
Beginning of the pandemic, MTN it cut off every charge that was going to be put for you to pay for any product.
And when they opened the economy, they increased the prices that happened during transactions. So your point being, again,
I want you to prove it. How did it affect people increasing the prices? Not just like they increased the prices.
It increased the prices regarding transactions. So let's say you're going to withdraw money from your mobile account. Before, let's say withdrawing 1,000 was free. Now you're going to pay an 100 extra fee. Now, do you think motorcyclists, that 100, they did not want to lose it to begin with? And it even goes to even bigger transactions that continue to increase. The more you deduct from your account, the more money you pay for the transaction to happen. These people end up making losses and they're not willing to comply to this. So they would rather have money, liquid cash. And at the end of the day, the problem you tried to solve didn't actually be solved, but now you have people walking around with liquid cash, spreading the virus to one another, and your over-ambitious strategy that overestimated the way people would actually comply didn't work, and now you have more people with the virus, more people with liquid money, and you didn't solve anything with a policy that didn't even help the people.
Did your government consider all this before getting us out of a lockdown? Do you think it considered it?
That's not no, that's not the debate today, but even if it was, it's clear they didn't, because had they, this wouldn't have happened. Proud to propose.
The motion of ours today being, this House regrets the reopening of our economy. Ladies and gentlemen, I agree with the keywords that they stated, the first speaker stated before. But first of all, they came with arguments and talked about lagging of infrastructure, idea of cashless economy. The point of increasing of prices is on the people, not the government. So the point here being, the motion being this House regrets the reopening of our economy, we should only not tackle that the government of ours is only pointing at the point being reopening of the economy, but what we should only tackle is how the people responded to the measures and the precautions that were put in place or consideration that were put in place by the government of ours today. First of all, we are going to first let a clarification of how Rwanda got into this impactation or into these problems of COVID-19. The first case in Rwanda was on 14th March 2020 by an Indian who reported in Rwanda 8th March on the health center by 12th March. Rwanda was one of the first countries in sub-Saharan to order a total lockdown because of coronavirus, but then it had 17 cases across the country. When Rwanda put a lockdown, it banned all unnecessary movements, allowed only essential services like healthcare and shopping groceries. It again allowed order for both public and private workers to work from home and close its boundaries completely except for goods and cargo and returning of citizens. However, the returning of citizens made them quarantined for 2 weeks. However, a return of Rwandan has welcomed measures put in the country where many survive from hand to mouth and necessities of 100 M's, and there are no possible bailouts from central government to support small and medium enterprises. Meanwhile, authorities have warned businesses owners not to be increasing prices of basic commodities. Rwanda having been known as imposing draconic measures whenever crisis happens, and this is the time for coronavirus, it was not any different. I'll give you an example of a shutdown of borders to Uganda. This also led to another problem of that highly affected the Rwandans because some products were not in the country and some people lost their businesses. Rwanda came up again and announced on Thursday that it will allow some people to return to work from May 4th, easing the nationwide lockdown to combat a novel coronavirus in an effort to revive the economy. Ladies and gentlemen, argumentation for the opposition side are quite simple. The first argument, the government shouldn't regret giving life to the people because giving life to the people is letting them survive in a proper way. Ladies and gentlemen, having the government reopen the economy, that helped me to work, that helped me to hustle, that helped me to get an income that can treat my family well, that can increase on the standard of living for my people. The government doesn't have capabilities to feed these all citizens. If the government is still regretting, that means it needs, or it can get back to how it was. That has to mean, or that links to the fact that if the government doesn't have the capabilities to feed all these people, how is it going to go back to what it wants? Or why is it going to be regretting on the imposing or on the reopening of the economy? The government shouldn't be regretting what came as an opportunity for the people to start up small businesses. I'll give you an example. These small businesses, just like wearing face masks, using hand sanitizers, were not there in the country because we didn't know about COVID-19 outbreak in the country. So due to the fact that the precautions and measures to curb the spread of COVID-19 came, it's when these hand sanitizers and then this face mask also came about. This is when the people started working according to their need to survive. They started selling all these things, and then these businesses came about, and then this increased on the economy of the country. The government shouldn't be regretting that the monopoly power on market reduced due to the businesses that rose and started working in the pandemic. We all know that monopolies lead to a wide income gap between competitors, which is unhealthy for growing local businesses who have to strive to get market. And again, I'll ask them a question. If they're regretting on the point being that they're reopening of the economy, then what is so good about not reopening of the economy? That is shutting down the economy or closing the economy. The government shouldn't be regretting due to the fact that the early pregnancies that decreased in birth rates reduced due to the fact that it had reopened the economy. If the government reopened the economy, that is to mean the people are now bounded, or the people are now at their workplaces. If they are at their workplaces, they are now settling, or they're occupied by their work. Due to the fact that they are not going to be spending so much hours at home doing different things, that is to mean they're not going to be going into sex and then increasing on the high birth rates or the early pregnancies too. The government should not be regretting having opened the economy when the precautions and safety measures would have been put in place to curb down the spread of COVID-19. Ladies and gentlemen, before I conclude my speech, I'll first tell you a simple scenario, or I'll first tell you a simple story. Me and my siblings, Ian and Danny, we were living a hard life when the lockdown came. They told us at school that we are all going back home so that we also reduce on the spread of the COVID-19 in the country. When we reached at home, our parents were also set to remain at home due to the fact that the government had closed the economy. And once it closed the economy, then this time it's when me, Ian, and Danny were not able to survive in a well condition that we had before. That is to me, my family was not working, and we could not get or gain anything that lets us develop as the family as a whole. So I'm also proud to oppose my cases. You can ask me a question.
Point of information.
Yes, please.
Can you engage with the fact that we're not proposing for any alternative, including going back to a lockdown?
Well, what are you regretting for this time?
We're regretting the opening of the economy, and it's not our role to propose what would have been done.
Should the government regret the opening of the economy, or should regret the people responding to the measures and the precautions put by the government?
I think I'll answer to that in the second speech.
Thank you so much.
Point. When we're having discourse related to a global pandemic, it's good. It's the right thing to talk about trade-offs. So what you're arguing is you would rather trade off the economy versus the lives of the people you're trying to protect. So are you saying in your trade-off lives for money?
No. Wait, first of all, since the measures and the precautions are there, that means we are going to curb down the spread of the COVID-19. And if we are all well able to go and work or hustle for our lives so that the government doesn't feed us, then that is the well-being that we want as the government, or as the people.
Point. Can you engage with the fact that when you say that the economy opened up, that people actually got their jobs, because not everybody got their jobs, so people are still homeless either way. Can you engage with the fact that you assume that opening the economy means people get their jobs
This
back?
is the question that should come back to you guys, that what are you doing to solve all these problems that the citizens are facing? Because then that time is when? Well, thank you so much. I raise my case.
Thank you. Could we have the second speaker from the proposition side?
we sympathize with you and your families and very many other homes that were left without food and starving. But we're going to show you how the government took an overly ambitious strategy in trying to solve this and therefore caused even more problems, not only to the economy, but also to the poor people that it claimed to want to help. Now, a few things before I go into our case. Allow me to first refute what the current speaker just talked about. So he comes up here and says how the problem is how the people responded. But I'm saying the people respond because the government gave them the freedom to go out. So the problem is where this started from. If people responded by increasing the crime rate, it's because they were starving and the government had unemployed most of them because of this pandemic, and the government was saying they should go back to jobs that they were stripped of. Now, again, they come out here and say that we're not proposing anything to solve all these problems. But I remember my first speaker distinctly saying that this debate is about weighing on the harms of reopening of the economy 3 months ago. We don't care about the alternative. It doesn't have to be a total lockdown or closing of the borders. It could be opening few services one by one. This is not the debate of today. Don't even get me going into that lane. Now, coming back to what you were saying, you said you wanted to give life back to people, and we want to do that too, but how are we doing that? That is the debate of today. You said you want working income. Still, how are we doing that? You said people were given the opportunity to start small businesses, but let's look at the proportion of people who are actually involved in producing sanitizers and face masks. It's pharmacies that kept producing these, and funds we were getting from outside. Not a lot of new people, and even others who were doing so were making face masks out of wrapper material, which is not safe for anyone who wants to actually curb down the spread of the COVID-19. Also, it didn't, because people are actually producing illegitimate sanitizers just to fill in for the gap, because everyone is looking for a sanitizer and not willing to wait in line to wash their hands. You talk about monopoly, but it's funny that you brought that up, because I think we're actually going to show you how there's monopoly in trying to open the economy in the way we did, because it only favors the rich, because their kids still go to school, they still have jobs, they can work online, but the poor people, the teachers, are not employed, and other people who had jobs that required mostly physical contact with the people they were serving. Also, you come up here and say teenage pregnancies reduced, but I think that is wrong, because teenage pregnancies highly reduced back then when we were in the lockdown. 50% decreased because everyone was locked down home. And I'm not proposing to lock people down, but I'm just showing you that after reopening of the economy, all of these things spiked because everyone had an excuse for getting out, because everything was simply allowed to proceed. Now, allow me to go back to our case. So, allow me to point out that they were not able to engage one-on-one on any of the harms that we're bringing to the table today, and it shows that they agree with the harms that were imposed by the opening of the economy. We say it's overly ambitious because, like my speaker said, I was going to emphasize, we didn't have enough medical equipment. Today we have people who are being hospitalized from their own homes. That is sad, one, because it belittles the pandemic and conveys the message that it's okay for you to be sick and still be around your family members. Two, it is dangerous because then it exposes a lot of people to contagion of this pandemic. Two, the problem that in the medical sector was we were starting now to train local health advisors to be able to treat COVID-19 patients. That shows just how much we're needed right now, and we're trying to face the consequences of reopening the economy back then when we were unable to handle it. Also, we have doctors quitting today because they see that they're exposed to more danger and the country is not able to host all of this reopening of every single activity. And there's also the processing of fake sanitizers, like I said, because there's increased demand, people are going to be opportunistic and use this chance to produce fake products to meet the needs of everyone who's out there looking for a mean of survival. Now, going back a little bit onto the lag infrastructure, my first speaker gave an example of emptying, and I'm going to give an example of this hand washing idea. When you're going to a market and there's a line of more than 30 people and everyone is required to wash their hands for not less than 30 seconds, how many people have the time to wait in line when you're the 50th in number to wait to go into a market? We're going to look for sanitizers. How many people can afford those? Not many. So again, people are going to make fake sanitizers just so we're going to go to far heights to use illegitimate ways just to acquire services that will satisfy our needs. So what we're saying in this debate today is we're not proposing a lockdown. We're not even proposing any other thing. That's not our obligation. We're saying reopening of the economy 3 months ago without having thought about the long-term effects was not the way to go. Also, allow me to talk a little bit about the poor people and how they're not affected by this system of reopening the economy back then, 3 months ago. So what we're saying is when we reopen the economy, we're trying to help the poor people. But how does this actually help them? Because like I said, we allowed organizations that had the capability to enforce measures of social distancing, all these other things, and markets and hospitals, things that are essential. But then we did not consider the poor people, the teachers who were unemployed, the janitors, and all these other people who are low-income earners, who are not qualified and were probably fired from their jobs because of the economy that was staggering then. Now the problem, like my speaker said, is we're not able to break the intergenerational poverty that our country is facing, because the only chance to eradicating and reducing the number of poor people was education that these kids were getting for free, being helped by the government, or at least getting funds from other sponsors we have. And all of this was eradicated because only the rich are actually supported by the system of reopening the economy. So what is it that I'm saying? That this was counterproductive. It was for the good, but it was counterproductive. Thank you.
So basically, when you talk about medical equipment, do you relate it to COVID-19 or any other medical treatment? The next thing is, are you aware that fake sanitizers were also there in the days of a pandemic? And about the doctors quitting, are they all medical doctors or these doctors that are dealing with the COVID-19 pandemic?
I'm saying doctors who quitted were the ones who were threatened by the idea of contagion and them realizing that there's not enough medical equipment. Also, the medical equipment I'm talking about right now that I'm concerned about is the one that's able to cater for the contagion of COVID-19. I'm talking the quick COVID tests, all of these things that we require to be safe. What was the other question?
Are you aware that fake sanitizers were also there in the days of
Yes,
pandemic?
yes. But the problem is now
What is
that
the
they have a
difference?
lot of demand, so it requires supply. And when there's a wrong kind of supply, which means the fake sanitizers, then people are still going to be affected because they're not
Are you aware
protected.
that the government has come up with a plan to curb these fake sanitizers?
See, they realize that there's a problem that was caused by the lagging infrastructure, so they're trying to curb the effects that were caused by reopening the economy when we were not able to host the policies.
Okay, so thank you. You're saying that one of your most points of views as the proposition is to say that the spread actually continued by the fact that we opened the economy. And mind you, if we can actually go deep into statistics, you may know that during the lockdown, some of the people, like the doctors and the soldiers, still worked. That means the spread was still there and capable for them actually to spread it.
Well, do you propose that we close down hospitals? Then what is the chance that we save people?
All we're saying is not that.
We were risking letting doctors go to work because we hoped that some people would actually get saved by this. When it's essential, it's essential. It's a matter of life and death. We can't stop food, we can't stop hospitals because that's a matter of life and death. Thank you.
So thank you, ladies and gentlemen. The motion being this House regrets the opening of our economy. Basically, ladies and gentlemen, I want to inform you that basically one of the ways that the government had put in place to curb this spread of COVID-19 and controlling people was putting youth volunteers and then police officers in every place for them to overview what people do, what people are going through, ladies and gentlemen. That was one of the ways to control opening the economy and control the people. But the problem here is the problem reopening the economy, or the problem is how people responded to the COVID-19 measures, which was a problem, ladies and gentlemen. So basically, people did not respond to them. They talked about fake sanitizers, fake face masks, but the funny thing is she's putting on one of them, which is the face mask that is fake, which proves how people are not able, how people are not willing to comply with what the government tells them. So if she can put on a fake mask, use a fake sanitizer, that means the problem is not the government, but the problem is you. How do you comply to the measures of the COVID-19, ladies and gentlemen? So basically, I will tell you the fact that fake sanitizers were there in the days of the pandemic, and now the government has come up with a way to curb these fake sanitizers. Ladies and gentlemen, I want them to basically, I thought that the government coming up with a plan to curb these fake sanitizers and these face masks was a fact of trying to make people curb the easy spread of the COVID-19, which was a good thing. So, don't you think the government had a way to maybe curb other things than maybe advocating for a regret? Because people being given a chance for them to work and have lives again is a good thing, ladies and gentlemen. My first speaker talked about the thing of monopoly. During a lockdown, we had these businesses like Vuva, which was delivering food. That means they were working, which means it was a monopoly market where other people were not able to work, or maybe other businesses like some restaurants that were delivering food. But ladies and gentlemen, I want to tell you that before this, and one of the things that I will likely want to inform you is that for anything to open in our economy as Rwanda, you need to first comply with all measures of the COVID-19. I'll give you an example on tourism, ladies and gentlemen. On tourism, I talked about the fact of before opening the tourism, they had to first ensure all the measures to curb this COVID-19. And when they complied to them, that is when they said, yes, let us open. What were the measures? Having a way of washing your hands, putting on a face mask, and the next thing was being able to test all these people that were there, ladies and gentlemen. Basically, ladies and gentlemen, there is this thing used for you to know if you're having this COVID-19 in your cells. Just that is being under a lockdown or being maybe in a quarantine for 2 weeks, which is very simple for these poor people who cannot afford $50 for them to be tested, but stay in a lockdown for 2 weeks and then be able to know if you have some symptoms and then any other thing. And mind you, all those people who have symptoms are clearly tested for free by the government, which is a good thing to curb the spread of the COVID-19, ladies and gentlemen. So basically, I'll likely ask, I'll likely, if they're regretting this, that means we have to look at what we had before and what we had now. Ladies and gentlemen, one of the best earning sectors of the government is the tourism sector, which was reopened after we opened the economy, which is one good thing that we're getting visitors from outside to come spend money in Rwanda, then boost our economy, people get jobs, people get good lives, ladies and gentlemen. There is employment, ladies and gentlemen. She talked about teachers who are unemployed, but mind you, the government still kept paying all these teachers, and I'm quoting Rose, who is the leader of Minedik. She clearly stated that all these teachers were being given an amount of money at their salary, which means this is not starting point. The first speaker talked about a point of trade-offs, people for money. Ladies and gentlemen, we're not looking for people, we're not taking people for money, ladies and gentlemen, but we want people to work for at least an amount of money that can help them survive. Because one of the problems we had in the pandemic, we had a high crime rate where people were trying to steal some things, but then, ladies and gentlemen, after opening our economy, people were able to go work in markets, people were able to go do things, ladies and gentlemen. So I want him proposition to prove to us how 30% of people who are working in markets is it's not effective, because we had to cap a big number of people who go to markets. We had to put these things. Basically, ladies and gentlemen, she talked about increasing prices on the paying on with MTN thingy. But ladies and gentlemen, I will also be praised to inform you that one of the measures that were put by government is that they instructed all businesses to not reduce, not to put increase on basic commodities, ladies and gentlemen. And MTN also had to cut any amount of money that was used paying this, ladies and gentlemen. And also, there is a company called Tap and Go, which brought something called Tap and Pay, which was one of the ways to cap the spread of COVID-19. And the number of people are using that in Rwanda, which proves on how the cap of COVID-19 and then opening our economy is a good thing than what they're regretting, ladies and gentlemen. So basically, the point of clash here is, do we regret opening our economy, or do we regret people not complying to the measures and precautions of the COVID-19? Because a lot of people, like how he's putting on a face mask, which is fake, is not complying to the measures, which is very simple and likely for her to get the COVID-19 disease, ladies and gentlemen. So basically, she talked about medical equipments, but if you're talking about COVID-19, I want to inform you that my time. Any questions?
Can you engage with the fact that the numbers of reducing number of people in markets was in the lockdown when everyone was not allowed to go out, because right now people have excuses? Also, can you engage with the fact that we don't have police officers to feed every single district and sector, to emphasize that these things are reinforced to the small communities? Also about the monopoly of Vuba Vuba, how can we sympathize with businesses that don't exist? If Vuba Vuba doesn't work, what is its competitor? It was not monopoly. It is the business that was functioning. So it's not monopoly when they're not overshadowing another business.
Ladies and gentlemen, if they talked about, if they're talking about monopoly, there is this thing of over-consuming the citizens. Because like if you're a monopoly market, that means you're going to set any price that you want, which is actually over-consuming people that did not even have money at the time. She talked about police officers. Mind you, ladies and gentlemen, I want them to prove to us how ineffective were these police officers and youth volunteers. The point of bringing youth volunteers, it was that they had to comply or help these police officers to be able to measure this. What's your point?
Okay, so the fact that people didn't comply is the issue, but don't you think that's exactly why we're regretting the fact that people didn't comply when the economy was open? Let me finish. You talk about
the economy, but the point is, are we regretting the economy or regretting what people did not comply?
I can ask? Okay, so you talk about tap and pay, and it's quite ironic that you talk about a service that's only operating in Kigali, that again, the same poor people in rural areas cannot access to. So isn't it exactly what we're saying, that your economy only opened for the rich? Same argument you make with tourism having opened, again, it's just the privilege. They're going to go tour those gorillas. You think a person who doesn't have money is going to go work?
The fact that tourism already affects the whole country, because the money we get is supplied into every person in the area for them to be able to get money, ladies and gentlemen, which is a point.
And I'll ask again, is it a trade-off of money versus people?
Right. We have the third speaker. Reminder to hold your mic well.
So today the opposition decides to bring a case whereby they're regretting the people not complying to the measures of protection of the COVID-19. But we have brought a case whereby we're showing exactly why these people are not complying with these measures of protection. That's because we reopened an economy without being able to cater for the consequences that may come out. Those being lagging infrastructure and underdeveloped or insufficient medical equipment. But before I go to our case, I would like to refute what they said. Number one, they talked about the government has already started curbing down the use of fake sanitizers, people who are not wearing the adequate masks. But isn't just that proof enough that we should actually regret, since we have reopened an economy, let people go out, yet they don't have the means to have these sanitizers. They don't have the time to wait for people to wait for a long queue of people washing their hands. Number two, they talked about the measures that they have taken. Number one being free testing. Free testing is, and number two being that you actually don't need to have a COVID test in order to know if you're positive or negative. You just have to be quarantined for 2 weeks. This is unrealistic because number one, what the COVID test is $50. The government we have not seen, our government has not done free testing like other governments have, whereby in the roads, in the streets, people are getting tested. So we are still favoring these rich people who can afford $50 to go get tested and be safe of this pandemic, and yet they're here claiming that they're helping the poor people. Number three, they are talking about they want to help poor people, they want them to go at work, but can we actually handle the consequences that will come out of that? Number one, since we have proved that these poor people are still the same people who are most susceptible to this virus in itself, and that number two is that even these measures that were put, they can't even afford them. Some people can't afford good masks. Some people can't afford these hand sanitizers. So why are we letting out people yet they don't have the means to actually protect themselves? So whatever they're saying does not stand in this case. They're bringing up a point where they're saying that tourism and whatever other sector reopen so that they can benefit these poor people. But we have shown how this is still benefiting the middle class, because we believe that when companies were chasing people, when companies were reducing their workers, they went first with those people who don't have degrees, those people who are doing minor jobs, and still left those who have degrees, have their laptops at home, and they're still working, still earning their income. How can they claim that since the fact that they are reopening an economy which is not employing these people they are actually wanting to help is solving whatever case of poverty or of whatever bad life they want to improve. Now our case is exactly showing we are regretting the way in which we're exactly regretting the way in which the economy has reopened. We let out a lot of people, yet we did not cater for whatever consequences that may come out of it. Now, this is because we had lagging infrastructure. Number one, talking about the mobile money. They talked about a case whereby that they made it free, but this was in a total lockdown. Now, when they reopened the economy, MTN actually took the advantage of monetizing that same measure they're taking and making it more expensive. When we're making it more expensive, these people will actually, if I have to withdraw money and incur a loss, I would rather take it liquid cash. And even for the poor people, this becomes even worse for the poor people, since they have little, so they don't have any room for whatever loss or whatever extra cost they have. So they will go for the illegitimate ways, which we have talked about, which is liquid cash, and hence also exposing them more to the contagion. Now, number two, the insufficient medical equipment, whereby we're talking about where we have seen a case in Rwanda where they are starting to treat people from home. But this is actually, number one, exposing more people to the contagion since you are living with an infected. Number two, we're not seeing that we are conveying a message that COVID-19 is petty. COVID-19, because if I listen to a person who recovered from home, I will actually not even take into account of starting to strictly adhere to the measures that were taken up, because I will see that COVID-19 is petty. COVID-19 is something that you can go home and be treated with someone who's not even who are not specialized, who are not experts in the medical sector. So this is actually bringing a mindset that people should belittle this COVID-19 because it is petty. You can stay home, drink tablets, and it's over. And which is actually bringing us more to not adhering to the measures whatsoever. So we should. Any questions?
Why should the government stand on no possible bailouts to support small and medium enterprises despite of the unforeseeable future?
So,
You talked about the fact of we cannot handle the effects. And then I come back to my point. If we cannot handle the effects, is the problem reopening the economy or the problem is people complying to the measures and
Okay, I
precautions?
will answer that. Can you please repeat your question first?
I say, why should the
Give me
government
the
stand
chance.
on no possible bailouts to support small and medium enterprises?
So
despite-
we're not, that would completely assume that we are not going to reopen the economy. So what we're claiming for is not reopening the economy, rather how it reopened. What we want people is those small and medium businesses to open, but how are we opening? It is step by step. Let's go for what we can handle first, because those people who are going to open, those small and medium businesses you're claiming are going to reopen, are going to have, are going to increase whatever spread we're going for. Your measures, and so your question still stands?
You talked about you talked about the fact that can we
We
handle
can't
the-
handle.
the
Okay,
so
so
what's the problem of not us
the
handling?
problem is how we reopen the economy. We let all the activities out, actually when we open the economy, of course we are risking that there is going to be a certain increase in the active cases of COVID-19. So when we open a huge number of activities all at once, that is to mean that we are pushing people. Let me first answer you. We're pushing people to getting more exposed, so more people are getting sick, and then more people will.
Do you consider people
So
not
we're
com-
straining the resources
Yes.
that we have.
So do you consider people not complying to the precautions and measures of the COVID-19 as a problem?
It is a problem because there is lagging infrastructure and because we don't have sufficient equipment, and this leads to the belittling of the COVID-19.
Good morning, ladies and gentlemen, both chambers plus the judges. Going back to what the affirmative is saying, ladies and gentlemen, as me, the third speaker, I'm just going to help you outweigh what the impacts they're talking about. Leaving the proposition side, debating about weighing the negative impacts and the positive impacts, ladies and gentlemen, said by the second speaker. They talked about some of the POIs saying doctors were quitting. We asked them, ladies and gentlemen, this is a statistical debate. Let them tell us how many doctors are actually quitting. Are we talking about the doctors that actually deal with this pandemic or the general doctors, which they did not answer, ladies and gentlemen? They talked about the trade. Are we actually advocating for the trade more than the people? Advocating for money more than people. But mind you, ladies and gentlemen, we told them that their main point was saying that the spread will still be there. Mind them, let's tell them the answer. If we're still in a lockdown, some of the people were working, mind you, ladies and gentlemen. And if they're still working, that means exposure is still there, ladies and gentlemen. They can't be 100% less exposure. And if the exposure is there, there are nurses who can get affected, go back home and infect the family members, ladies and gentlemen. So that means either way, there would be still exposure, which they not talk about, ladies and gentlemen. I asked her the question. She said that she will not. Are we advocating to lock down the hospitals? Which I said we're not saying that we're going to lock down the hospitals, but that makes your point meaningful in this debate because still exposure is there unless you show us how you're making 100% less exposure. Ladies and gentlemen, the third speaker talked about the problem of increasing charges, and mind you, ladies and gentlemen, the charges were increased after the lockdown. Why? Because people are now given chances to work. People are now working. MTN had lost a lot of money. That means they had a chance to see if they can actually bring back the money. Ladies and gentlemen, they talked about the 50% decrease of teenager pregnancies, and mind you, this was during the lockdown. Now, according to the report that was said by Dr. Kagaba, who's the CEO of the Health Development Initiative, he said that there was an increment of 17.4% of teenager pregnancies after the lockdown. Why? Because of the incest sex that was done by what? By family members. And ladies and gentlemen, this was just because of what? Because of the fact that these people were at home while they were idle. They said that we don't have their main points being larging of infrastructures, mobile money increase, and insufficient medical equipment. My second speaker said clearly, are we saying that we should have let the lockdown still be in presence because we do not have the infrastructures to combat it? And mind you, ladies and gentlemen, when the government was going to open the economy, it had put their bodies that were responsible to actually go and evaluate what it had said. And mind you, there were structures of equipment that were put in place. Like, not all people had to go back to work. A little number of people had to go back to work. I don't know about people had to go back to work. And mind them, they are saying that we opened a lot of business at the same time. Not all businesses were open at the same time. Businesses that did not feel the equipment that the government had put in place are the ones that are not opening, ladies and gentlemen. Now, ladies and gentlemen, they talked about, the third speaker talked about people being poor to afford the sanitizers and face masks. And mind them, is sanitizer the only option of actually avoiding the spread of COVID-19? No, water is also there. Unless she proved to us how many people can't even afford that water, which makes it a greater negative impact, don't take the debate. Now, ladies and gentlemen, they're saying that they're actually regretting on how they reopened. Well, I asked them, what do you mean by how they reopened? Because they told us the way they would actually advocate for is the way that they would open little businesses step by step, which is what the government did. Because not all businesses opened at the same time, mind you, ladies and gentlemen. Let's all remind ourselves. Did all people open at the same time? What? That means that the government put people from district representatives to go actually and see if the businesses that will be opening were fulfilling the requirements. If they fulfill the requirements, then they're obliged to open, ladies and gentlemen. Now, mind them, they did not show us how, ladies and gentlemen, it was of a greater impact because they said they're going to outweigh. They did not show us the positive impacts about the reopening and negative impacts, and then give us statistics of how they're saying that these people actually were negatively impacted, which they did not tell us, ladies and gentlemen. Leaving us saying that we gave them point of monopoly, which they actually don't tackle because we said Vuva worked during the lockdown, leaving other businesses in a gap of not working. They talked about we talked about police officers and youth volunteers being in presence to help evaluate the policies that the government had put in place and the well-being of the tourism sector, just because we let it actually we gave it a chance to actually back up. And mind them, they're talking of the fact that people were poor during the lockdown, saying that, like the second speaker had said, she said that because the government actually opened the economy, that's why people actually now getting the spread on a higher basis. Rest my case. NPOS?
Can you engage with the...
1 minute.
Oh, 1 minute. Thank you. So what I was saying is this: leaving no statistics of the quitting doctors in presence, because we don't know if at all it's a problem. Because if the doctors that deal with COVID, that would be a problem, but they don't tell us those doctors. Leaving there. The point of the 15% decrease in teenage pregnancy actually does not stand, ladies and gentlemen. And then, most of the arguments did not have a citation of a realistic source of information that actually we would say that this is in Rwanda specifically. What if what they're saying is happening in Burundi? Because we don't know if this happened in Rwanda. And most of the arguments, ladies and gentlemen, where they say that most of the people are losing jobs because of the reopening. Why? Because most of the people do not have actually those sanitizers, that water, and put in exposure that leads to a greater negative impact, as the proposition side says. I think this is what I say.
Can you engage with the fact that the step-by-step that was employed did not equal to the resources we had, so it wasn't step-by-step enough? The second point we have is, can you relate to us the number of increase in pregnancies to the reopening of the economy because people are staying in their own families? We think it's actually because everyone is out there and allowed to do whatever they want in the name of resuming every economic activity.
And mind you, should I ask you a question? So you're saying that the government, it opening up the economy is done that increase the teenager pregnancy, and yet, if I could quote you right, what you said it was a 50% decrease during the pandemic.
The lockdown.
During the lockdown. Well, we said it was a 50% decrease, yes. But then after the lockdown, ladies and gentlemen, because we could not make statistics of people who were impregnated during the lockdown because no movement was made. Well, we said that according to the report that was actually given out on 4th August this previous month, where Dr. Gawa said it was a 17% increase because it was actually a survey that was conducted after the lockdown. That means it leaves no case of them saying 50%.
Which means that it is also dangerous to the teenagers because we reopened the economy.
No. Ladies and gentlemen, another question?
Yeah. Can you show us a link between opening the economy and people automatically getting jobs if they had lost them to begin with?
No, that's the point I was also going to say, ladies and gentlemen. We talked about the fact that when they reopen the economy, they don't open for all peoples. Now, she's saying that most of the people may have lost their jobs. That's why we're saying that we don't regret the opening, because the government is not going to bail out giving them actually the support that actually boosts back the economy. Well, we say that the fact that they let them open, because they say that we should be advocating for lockdown. Well, I said it's not the fact that because the second speaker turned out the debate where we are going to debate about the way of the negative impacts and positive impacts. That's why I went into the impact, saying that regardless of the impacts, they're telling us that actually were negative than the positives without a realistic statistic. That proves us that leaves the arguments of no standing in this debate.
Okay, so let's say that no one here argued that there was no overall good. We said from the beginning there were goods, but the only good.
All right, 2 minutes to prepare for a reply speech. All right, negative. Reply, 3 minutes. Uninterrupted. I'd like to remind both sides that you're trying to convince us on why we should vote for your side, why you provide a better case.
The motion of today being this House regrets the opening of the economy. The proposition brought out different cases like medical treatment, the mobile money increase, fake sanitizers and masks, doctors quitting, pregnancy increase of 50%. But ladies and gentlemen, the 50% had no citation. But my third speaker talked about the 17 increase in pregnancy after the lockdown, it was the research made after the lockdown, because in the lockdown, no movements were there. So we cited HDI, the Health Development Initiative, which gave out the information, ladies and gentlemen. We asked them if they talked about doctors quitting, were they general doctors or doctors dealing with the COVID-19 pandemic, ladies and gentlemen? They talked about medical treatment. The problem was, were they talking about the fact of all hospitals not having furniture or anything, but basically hospitals with dealing with the COVID-19 pandemic, where they failed to shed more light and show us how that's a reason to regret, ladies and gentlemen. So basically, team opposition, we didn't advocate for a regret, but ladies and gentlemen, if we were to regret, we would regret how people complied to these measures and precautions of the COVID-19, ladies and gentlemen. But the team affirmative came up regretting reopening the economy, not specifying at least how people complied to the measures and precautions, ladies and gentlemen, leaving them no chance to take the debate, ladies and gentlemen. We talked about, we gave them different arguments. By my first speaker asking them, what's the good reason with closing the economy, which was like something they advocated for, because they talked about they opened that in the poor way. So we asked them, what's the best thing with that, which they never showed us, ladies and gentlemen. We asked them about a question of why should the government stand on no possible bailouts to support small and medium enterprises despite the unforeseeable future, which they never clearly stated how the government would tackle that, because the point was people were not having a way to survive, even though they get out of the lockdown, but they still have no money to survive. That is why we had to provide them a chance to work, a chance to make money, and then help their family survive, since the government was not doing anything to help them, which is a good impact outweighing the negative impact, ladies and gentlemen. So basically, they talked about rich people being the only one favorable in this state. But ladies and gentlemen, I talked about the tourism sector, which is highly favoring the whole country in large, which is one of the factors that rich people visit. Now, rich people are also benefiting the poor people, which is a good thing that is outweighing what they were talking about, ladies and gentlemen. She talked about fake sanitizers and masks, but never proved to us how that does not link on our point of people not complying. Because me putting on a poor face mask is me not complying to the measures, which means that's a problem that they might have regretted too, which is very different from what they talked about, ladies and gentlemen. But ladies and gentlemen, talked about policemen, these youth volunteers who are highly helping the government to cap the spread of the COVID-19. And then, ladies and gentlemen, the point was, since the motion stated, this House regrets the opening of the economy, we had to look at the fact of the spread of the COVID-19, which we realized that the spread highly was caused by people or us not complying to the COVID-19 measures. I raise my case, and I think with all this, we take the debate today. Thank you very much.
Thank you. We have the affirmative close out the debate for today.
So they kept asking us what we would do, and we clarified from the beginning, we're not providing an alternative. We're just showing you how bad it is that we opened the economy 3 months ago without the capability to handle the consequences. Because whenever an economy decides to open up to all activities, they know that there are going to be consequences. They know that active cases will increase. So they must do everything they can to ensure that they have an economy or measures in place that are able to cater for the consequences that will arise. And our government clearly wasn't able to. So they said they wanted to help the poor people to go back to work and find an income. And I find it sad that you don't know the meaning of a pandemic. It is something that's highly contagious, and if you care about the people really, you'll care about their health, because without their health, they can't work, so they can't make money, so there's no income. So instead of even starving, they'll die because of the pandemic. Also, you talked about exposure, and we showed you how we were not advocating for zero exposure, but minimum exposure whose consequences we can account for. Also, you talked about, we showed you how people are jobless, and therefore they're going to result into legitimate ways to satisfy their own needs. They're going to become thieves, and very many other various things they can do to attain survival. Also, you said you wanted to help the poor people, but what makes you think that as soon as we open, people are going to be rehired? Because we have a lot of people who are unemployed because of the need to reduce the number of employees. Also, how can you assume that we can be able to cater for the consequences simply because we want to help people? That's a good thought, it's a good motive, but it's not practical. Also, you said people not complaining is a debate of today. And I'm going to show you that people will always be people according to this debate, and therefore an actual government should play out its role of trying to put measures that can help people protect themselves, because we're not going to wait for a time where they will all turn into sense and respect the measures. So what we're saying today is that reopening the economy 3 months ago, when people still had the poor understanding and had poor face masks and all these other opportunistic ideas that came and increased the contagion, we did not have any right to let people go out into their activities. You talked about doctors quitting and all of this and medical equipment, but the problem is not if the doctor is a COVID-19 trained person or not. They are all doctors who are quitting because of the fright that the medical equipment was not able to cater for the contagion, and therefore they decided to resign. All of this causing a large gap in the demand and supply of medical services. Also, you keep saying compliance. Compliance is a problem, and it's what we're saying. We're saying we opened when people were not able to comply because MTN was being harsh, because waiting in line to wash your hands was too time consuming, and people do not have that after an economy staggering because of a pandemic outbreaking. So what we're saying is they did not head-on attack our arguments of medical equipment and lagging infrastructure. And they were not able to show us how the poor people were favored, because they come up here talking about tourists who will show you that are luxurious people who still show us how the rich were the ones who are favored by this. Education, the one chance the poor people have to regain their lives back, was shut down, and the rich kids are still studying online. So all of this was not an alternative debate, and they were not able to head-on refute our arguments, but we showed you that in their world, the harms are there to be regretted, and they weren't able to provide any good for us to actually consider not regretting. So we showed you that the harms outweigh any benefit that they would have wanted. So the motive was nice. The motive of trying to save people was good, but the way in which we did it, by letting out everyone that in a way that outweighed the capacity we had to cater for it, was just wrong. I rest my case.
All right, great debate. I'll get each judge to maybe give a little bit of advice or something that you guys could have done better. Any one of you can start. All right. You guys want to go up, or you could just...
Well, in my opinion, I think everything here was good. And if I was the one to tell you something to cut out, because I wouldn't say anything like, not everyone is good enough to be able to satisfy every person. But according to my opinion, you guys quoted the motion well. And I think if I, as a debater or as a judge, that is enough to make a person like be able to analyze what he or she's going to say. So in my opinion, I think everything was good. And if I was going to tell you to add something on that, please just try to control your rushing. Like, you rush too much. Like, in my opinion, there are some people whom here I was able to quote everything they said, but others I got like, it's not like I didn't get anything in what they said, but I didn't get everything that they said because it was too rushy. And if I heard what they said, well, they told you to please be able to slow down everything you're saying. And next time, in the next debate, please try to, even if you say something which is not bigger or which is not many, at least someone could be able to get what you were saying. Because since if something is small, then you must be able to analyze that small thing can be able to contain something which is bigger, which will make you win. Like, saying everything rushy cannot make you like the winner of the debate. So next time, control your speed. And apart from that, everything was good.
Okay, to add to what my judge said, I noticed something. You might have good points, really very good ones, but here you're trying to convey a message so that you get what you're speaking and make a good judgment, and so that the other side gets to connect with what you're saying and give a good verdict. And another thing I noticed, we don't want, okay, you answer the points well, but there is a way you move around the point, but you're not getting to the exact thing. So when you're debating, get to that exact thing. Not moving around the circle, but not getting to the thing. Thank you. Otherwise, you're good.
I would say the debate was good. A few things that I noticed on both sides. Just repeating the same arguments doesn't make it more convincing than the time you said it before. you need to spend a little bit more time explaining to me or giving me, fleshing out why that argument actually makes sense. The other thing too is like, you guys, I think you all on each side make claims, but without really explaining to me why should I believe you on this side, not on the other, right? And one thing that I regret in this motion is the fact that I thought there was going to be a whole lot more weighing on economy versus health, right? Because I think that's at the core of that, of the question of whether they should reopen the economy, right? Is the question of, is people's health more important, or should we make sure that we prioritize the economy? And I think that there was almost like it could have been good if it was there, because I think it would have flashed out what the main, the core controversy, at least of reopening the economy was. But otherwise, good job. And yeah, I think you guys deserve being in the finals. All right.